Hello, my name is Fatima Tafufana. I'm here to do a presentation about exploring a variety of contemporary issues with our own area of health and social care sector that influence the service improvement. Health and social care industry in the United Kingdom is facing several new challenges that might have far-reaching consequences for the future of the sector. Individual community might have far-reaching consequences for the future for the sector. Individual community and healthcare system all confront new demand and obstacle. And this problem reflects that there are a few instances of this. The population is becoming older, much like population of most influenced nations. With a larger older population comes a greater need of medical attention, especially for chronic condition and the care of the elderly. This may improve the service, should center and encourage healthy aging expansion, access to genetic care, and coordinating and delivering of social service and medical treatment. Suffering from mental health crisis, increased rates of anxiety, sadness, and other mental disease are a major cause of worrying in the United Kingdom. Early intervention more available. Mental health specialists and greater integration of mental health service within the general care are just a few of the service change needed to address in this epidemic. Health care across different social economic group and different region of the UK exist, focusing on unserved area, advocates and prevents healthcare and guaranteed universal access to high quality medical service for all people, regardless of their social economic status or geographical location, are all essential steps in achieving this goal of service improvement. The rise of digital and healthcare and social service industry may benefit and be hindered by technical development. Telemedicine, remote monitoring, and electrical health recording are just a few examples of the kind of digital solution that should be investigated as part of attempts to improve service. Data privacy, digital literacy, and risks of extrapolate inequality are all important concerns. Lack of working and keeping them around, finding and keeping a diverse and competent staff, is a major concern for industry workforce planning to train and develop, as well as managing workload, burnout, and the availability of necessary support, and the resource must be at the center of any service improvement and strategy. Cooperation and the mutual understanding, delivering patient-centered care and enhanced results require better coordination and cooperation between health and social care provider. Critical area for service in improvements including removing organization and structuring impediments, encouraging interdisciplinary cooperation, and facilitative effective communication and coordinating amongst diverse care providers. This is the variety of contemporary issue on the area of the health and social care that could influence the service and improvements. Analyzing the key perspective and impacts upon care and upon care and delivering. The move towards person-centered care is an important viewpoint that is having noticeable effects on care delivery in the health and social care sector in the UK. Care that puts patients at the center, emphasize individual treatment plan, and consider each person's history, preference, and value. This method promotes collaborative formats authorized on their own experience. Person-centered care has far-reaching effects on the health care system. Better health outcomes are the result of increased patient satisfaction. In this, an increased treatment adherence. Patients have a better alliance with their healthcare profession when they are actively involved in their treatment because they feel more empowered, engaged, and knowledgeable. The results of therapy may improve healthcare expenses, may go down, and resources may be used more effective if this is the case. The National Health Service provide an operative example of person-centered care that it's incorporation of care planning coordination. The NHS has implemented care planning mechanism, encouraging patients participating in treatment choice, care planning, and process in which patients and their healthcare team work together to establish treatment and objective. Patient's preference and strategy for achieving those objectives. It makes sure such that those receiving care have a voice in choice that affects them. Care planning is used to feel like mental health, to create individual treatment plan that consider the whole person, not just their physical condition. This method acknowledges the need for the multidisciplinary team approach, which include patients and their family and friends in, in the treatment of mental health issue. The healthcare system in the United Kingdom is undergoing radical transformation as it moves from provide center center per, centered to a patient-centered one. This way of thinking is giving people more control over their healthcare, boost the effectiveness of treatment, and make it more pleasant for patients. Hypothesis of minimizing disruption of service and based upon on identifying contemporary issue. Implementing technique and approach to the problem. The UK health and social care industry is necessary to test hypotheses about how to reduce service disruption caused by those more than difficult. There are few instances of this. Increasing cooperation and coordination between health and social care provider. United Kingdom has implemented care system. The integrated service within the ICS allow for all greater emphasis on preventing care and identifying poor population and the delivery of individual treatment plan to reduce treatment that tailor to their unique requirements and concern, include both medical and non-medical factors and affect their health. As a result of remote consultation, monitoring, and virtual healthcare solution, telemedicine and digital health technology adopts may lessen service disruption. This pressure on the hospital and other medical institutions is lighting, and people with mobility issue or who live in distant place have easier access to treatment. Example include the risks of virtual consultants as a dominant mean of healthcare delivery during the SARS and the COVID-19 pandemic. This helped maintain patient care while decreasing the spread of disease. Partnership between the health and social care and professional body and the solution to the problem of lack of qualified worker and high turnover rates in the industry. This measure may help a positive and engaging workplace by easing access to training and permitting more adequate schedule and encouraging collaboration across the disciplinary. Health education, England integrates care training knob are a practical illustration of the concept since they facilitate across selectorial workforce development and training to satisfy the ever-changing requirements of integrated care. Conclusion, and again, population, a mental health crisis, health inequality, digital change, staffing shortage, and the need for integration are just a few of the current concerns confronting the UK health and social care industry. Better results may be achieved when treatment is provided with the workforce on the individual receiving it, minimize service interrupting is possible digital in advocate and collaborative workforce static. All of these increase access effectively and the quality of care. Thank you. My name is Fatimata Fofana. Thanks for listening to my presentation. My name is Fatimata Fofana.